cardiac stress test induced by dobutamine and monitored by cardiac catheterization in mice. In this video, we will present a step-by-step description of a cardiac stress test induced by dobutamine and monitored by cardiac catheterization performed in normal mice. We will also show its application to unmask subclinical cardiac disease in high-fat, diet-induced obese mice. The anesthetized mouse is placed on a thermoregulated plate. Oxygen supply is administered through a plastic tube, and body temperature is monitored using a rectal probe. For cardiac catheterization in a closed chest procedure, the carotid artery is used as the access via. The pressure sensor in the tip of the catheter is fine enough to enter the artery. To measure arterial pressure, the catheter is introduced approximately 10 millimeters. The arterial pressure waveform looks like this. To measure ventricular pressure, the catheter should follow a rectilinear pathway and pass through the aortic valve up to the ventricular chamber. The pressure waveform changes when the pressure sensor enters the ventricular chamber. To administer dobutamine, a plastic tube is introduced into the jugular vein. The drug is infused from a programmed pump that injects an increasing volume of the